This is Radio Health Journal. I'm Nancy Benson. This week, easing coronavirus stress.
I'm a little bit surprised at the general population's reaction, to buying up of toilet paper of all things. This is not the zombie apocalypse. We're going to get through this.
What to do when life is turned upside down. When Radio Health Journal returns.
I'm Reed Pence, the producer and host of Radio Health Journal. If you like listening to Radio Health Journal, you'll also like our sister show, Viewpoints, which covers a wide array of topics from education to history to the environment. Here's a preview of what they're covering this week on Viewpoints.
We will come out stronger, smarter, and with some new ways of doing things.
Finding the silver lining during these trying times. Then,
I'm like the pillars of appropriateness. How did I get there? This is how. But I also wanted to explain myself to my kids at the same time.
The Life Lessons of actress Drew Barrymore. I'm Marty Peterson.
and I'm Gary Price. These stories in depth this week on your public affairs magazine, Viewpoints.
Listen to Radio Health Journal and Viewpoints on your favorite radio station. And subscribe and listen anytime on Apple Podcasts, Google Play, and Spotify. Also, follow us on Instagram and Twitter at Radio Health Journal.
In the early days of the COVID-19 pandemic, experts wondered if it would be like the SARS epidemic of 2003. Both are coronaviruses and both started in China, but that's where many of the similarities end. SARS scared a lot of experts at first, but ended up infecting only about 8,000 people worldwide. It had a fatality rate of about 10% worldwide. But here in the United States, none of the 27 people known to be infected were killed. Eventually, SARS faded out.
It was another type of coronavirus. It infected the lungs. It was acute respiratory type of things. But it happened a little bit later in the spring, and I think a lot of the reasons why it died out was because of the coming of summer and warmer weather.
That's Dr. Michael Lewis, who, as a U.S. Army colonel at Walter Reed Army Institute of Research, established the nation's first syndrome-based disease outbreak recognition system. He was at ground zero in Southeast Asia during the SARS outbreak.
It didn't have the ability to spread as easily as this current one. And so that's one of the biggest things is the infection rate or the infectiousness, the ability to pass it from one person to another and then remain asymptomatic, right? So you could have somebody that gets exposed to it, has the new coronavirus in their system, and they can start spreading it even for up to a week before they start to have symptoms. And where can you go in a week? You can go anywhere in the world in a week's time.
Lewis says from his perspective, the COVID-19 pandemic is a lot more like what's known as the Spanish flu pandemic of 1918. According to the CDC, about a third of the world's population were infected, and at least 50 million people were killed. In the United States, nearly 700,000 people died, a rate equivalent to about 2.5 million of today's U.S. population. And it spread much the same way, with lessons we can still learn from today. For example, this tale of two cities.
In Philadelphia, they waited something like 10 days after the outbreak before they started closing the schools and events. And the death rate and the infection rate in Philadelphia skyrocketed. St. Louis, on the other hand, I think it was 1, maybe 2 days after they recognized that, hey, influenza's here, it's hitting us, and they shut everything down, and they had a dramatically lower mortality rate as well as a lower infection rate because they implemented these closures. And so that's the hope, that we want to be on top of this, be proactive, so that we're limiting the ability of this to spread person to person through large events.
Lewis is pleased that millions of us have been advised to shelter in place this time around, but he's been surprised at the public's response to it.
I'm a little bit surprised at the general population's reaction, to buying up of toilet paper of all things. And the panic that has ensued This is not the zombie apocalypse. We're going to get through this. Come the middle of summer, this is hopefully going to be a distant memory, and we're going to start to put our financial lives back together. I'm more concerned later in the year, the personal bankruptcies, the small businesses that have disappeared, just the financial hit. And then subsequently, what's that going to do to our general psyche? Are we going to see an uptick of suicides, for example, because we can't deal with the financial stresses that this is putting everybody under?
Today, Lewis deals with how the mind works and reacts every day as president of the Brain Health Research and Education Institute. He says that stress itself in a time like this is really no surprise. The pandemic is a perfect setup for generating stress, which thrives on conditions that are out of our control.
Implementation of some of these isolation measures, which are really important. I don't want to downplay that at all. We can't control that. You and I, it's being forced upon us, and I think for good reasons. What we can control is how we react to it. And it's always a choice. You can play Chicken Little and the sky is falling, or you can handle it with grace. We've got to realize this is not the end of the world. We need to handle it a little bit better, a little bit calmer, and it's a choice.
Lewis says dealing with stress is a big deal for your physical health and may even determine whether you get sick or not.
One of the bigger concerns is stress degrades our immune system. We know that. It's physiological, it's at the chemical and the cellular level. Stress hurts our immune system. So now all of a sudden we're stressing about this virus at a time when we need our immune systems to be strongest. And so it's a big reason why we need to get our reaction to this stress under control. And in many ways gets back to the basics, diet and exercise. Cut out the simple sugars, the sodas, the candy, the junk food, the processed food. Eat healthy. We should be eating fruits and vegetables, not potato chips. So eat healthy and get daily exercise, preferably, in my opinion, outside where you're getting fresh air and hopefully some sunshine.
And if you're out for a walk in the sunshine, you should also be out of touch for a while, exactly what most of us need.
Turn off the TV, or at least don't turn on the news. If you're stuck at home, like many of us are, pull up some old movies. Don't watch Contagion and some of the zombie apocalypse is just going to make your stress worse. Watch a comedy or something. But really, turn off the news and limit yourself to updates once or twice a day. One of the differences between the 2003 SARS and today's coronavirus is that constant flow of news.
Most Americans have never lived in times like these, when staying in place is what's expected of us, and the enemy is invisible. No wonder stress and boredom have begun to feed on each other. You can find out more about all our guests on our website, radiohealthjournal.org. Our studio producer is Jason Dickey. I'm Nancy Benson.
Radio Health Journal returns in just a moment.
Most primary care doctors expect to see more people with dementia over the next 5 years. But a new survey shows half of them don't think the medical profession is ready. Primary care physicians are on the front lines of dementia care, but nearly a third are never or only sometimes comfortable answering patient questions about it. Nearly 2 in 5 say they're never or only sometimes comfortable making a diagnosis. That's deeply concerning to Dr. Joanne Pike, Chief Program Officer of the Alzheimer's Association.
We're heading toward a medical emergency when it comes to ensuring dementia care will be available for all who need it. It's critical that stakeholders work together to reverse the shortage of dementia care specialists and enhance dementia care education for primary care providers.
The survey is part of the Alzheimer's Association 2020 Alzheimer's Disease Facts and Figures Report, which finds that, barring medical breakthroughs, the number of people with Alzheimer's dementia may nearly triple in the next 30 years. Find out more at alz.org. With the threat of coronavirus, social distancing has become the new normal. But staying safe presents unique challenges for more than 5 million Americans living with Alzheimer's and more than 16 million family members and friends serving as caregivers.
Public health strategies aimed at limiting contact with others are nearly impossible for people living with Alzheimer's who rely on family caregivers and others every day.
Beth Kallmeyer is Vice President, Care and Support at the Alzheimer's Association.
For example, people living with Alzheimer's may forget to wash their hands or follow other safety precautions. Family caregivers need to be extra vigilant in helping individuals practice good hygiene.
Alzheimer's families also need to anticipate that current care, support, and communication options may change and make backup plans. And try your best to stay calm. People living with dementia take their cues from those around them. The Alzheimer's Association has more tips at alz.org, or caregivers can call its 24/7 helpline 800-272-3900.
And that's Radio Health Journal for this week. Radio Health Journal is a production of MediaTrax Communications. Follow us on Twitter, Facebook, and Instagram to learn more. And check Apple Podcasts, Google Play, and Spotify for a library of past programs. Plus, you'll always find previous segments and information about our guests at radiohealthjournal.org. Join us again next week for another edition of Radio Health Journal.